The newsday continues here on One News Now. I'm Riza Diaz. The Health Department reports over 1,800 new COVID-19 infections. That brings the country's caseload to above 561,000, over 26,000 of which are still considered active. Now, around 93% are asymptomatic or mild cases. The virus killed 20 more patients in the past 24 hours, pushing the death toll to over 12,000. Some 522,000, meanwhile, have gotten better from the disease, with 9,700 new recoveries reported today. The Health Department is urging local governments where the B117 variant and mutations of concern were detected to closely monitor their local COVID-19 situations. As earlier reported, 3 new cases of mutations have been reported in the country. All were from Central Visayas region. To tell us more, we have with us on the line DOH Region 7's Chief Pathologist and Regional Spokesperson for COVID-19, Dr. Mary Jean Loreche. Ma'am, good evening.
Good evening po.
Ma'am, we have questions. First, can you give us please an update on your monitoring efforts in the region?
Yes, so last night we were informed by the head office and with the Philippine Genomic Center that we have 3 additional new mutations of concerned cases. Because remember, we submitted another batch of samples for genomic surveillance and sequencing. So we were informed that out of those batch that we sent them, we had an additional 3.
Ma'am, of these 3 mutations that you are referring to, where did these individuals possibly got the virus?
Well, we cannot really say for sure where they got this virus, but apparently it would appear that these mutations of concern is really in circulation right now.
Doctora, quarantine status could be downgraded, they said, to MGCQ rather by March, like cinemas may reopen. So what do you think is the plan for LGUs in the region in the light of these new cases?
We have been in constant communication with our LGUs. As a matter of fact, when the first report about our 31 mutations of concern cases, we immediately met with our LGU leaders and we advised them and recommended a strengthening of all the measures that we have been doing. Because if you also remember that all these cases have been isolated, quarantined, and released already into the community. These samples have been, when they were detected first for SARS-CoV-2, and these are the samples that we sent to the Genomic Center, these were already past the quarantine period. So all the contact tracing has been conducted already. Now, as to the quarantine status, Central Visayas has been in MGCQ since September, and we believe that we should stay that way. As to the opening of the cinemas as part of the opening for the MGCQs, maybe that is something that we would be conferring with our leaders here in Central Visayas, whether they would want to push through with it or maybe just to delay it a little while.
Doctora, 2 mutations were detected in all 3 cases. Can you tell us more about these mutations?
Actually, not just for the 3 new cases. I think there were around more than half of those mutations of concern cases had 2, meaning to say there is a co-occurrence of the 2 mutations, no? Yung ating N501Y at saka yung E584K, no? So a portion or half of what we have seen contain these 2 mutations. So we'll see. We will wait for the Philippine Genomic Center to further sequence these samples and give us a feedback on what the name of this variant under observation or investigation right now will be in the future.
Doctora, how about one mutation that was also found in the South African variant? Is there a chance that this variant is already in the country?
When you talk about the South African variant, well, definitely the UK variant is already here in the Philippines. We saw that already in NCR, in Bontoc, and we had 1 case in Central Visayas that was confirmed that that's ours, no? But as to the South African variant, that one I do not know. But for the Brazilian variant, that's the one that contains also the mutations of concern that we have. But then again, we do have to wait for the final say from our experts from the Philippine Genomic Center.
Ma'am, can you give us a general overview of the current COVID-19 situation in the region?
So here in Central Visayas, you will see that the past 3-4 weeks already, our cases have been in, especially in Cebu City, has been in the triple digits. We do have high cases right now, but as I kept on saying that the situation is under control, our hospitals are still, in the safe zone. We have only around 45% critical care utilization, leaving around 55% more availability of the beds. Our temporary treatment monitoring facilities, our utilization is just between 30 to 35%, which means we need to have ample spaces for these cases that need to be admitted. Also, I believe that everybody should understand that 85% of our total active cases are asymptomatic that do not require any hospitalization, but rather only for quarantining either in the temporary treatment monitoring facilities, or it can also be, they can be actually admitted also in quarantine facilities like hotels that has, signified their intent to become a quarantine facility for asymptomatics that are COVID positive.
Doctor, as always, thank you for your time and for your insights. That was DOH Region 7's Chief Pathologist, Dr. Mary Jean Loreche. The Education Department is now gearing up for the possible implementation of face-to-face classes. Undersecretary Diosdado San Antonio says schools that will be chosen for the pilot run must be in low-risk areas for COVID-19 transmission. San Antonio clarified that this will not be mandatory, noting that parents may still choose distance learning for their children. The official assured the public that health protocols will be strictly enforced in all physical classes once approved by the IATF and President Duterte.
Kahit po napili ang paaralan o ang lugar na maging pilot school nitong limited face-to-face, kung ang magulang po mismo, may magulang na isa dyan na hindi siya komportable na ang anak niya ay pupunta sa paaralan, hindi po dapat pilitin.
We'll be back with more stories after the break. Keep it here on One News.
Parts of Cebu, particularly in the northern part, have been so far experiencing light to moderate rain since yesterday. So the entire province is on a red alert status for Tropical Storm Auring. Pag-asa raised storm signal number 1 over Cebu, but local officials assure the public that systems are already in place ahead of Auring's landfall. Neil Sanchez, head of the Cebu PDRMO, said all disaster personnel and emergency rescue teams are on standby. Residents in low-lying areas, particularly in the northern part of Cebu, have been evacuated. Emergency responders are deployed to Tuburan and other towns in northern Cebu, which are prone to flooding and landslide. Sanchez said they are closely monitoring the situation in Tuburan because typical rain showers could cause high tide and massive flooding in the area. The regional police is also on alert status and continues to inspect disaster-prone areas to ensure everyone's safety. All trips from Cebu Port to Bantayan Island, Camotes Island, Carnaza Island, and Negros Oriental are also cancelled. This resulted in about a kilometer-long traffic along Tabuilan due to stranded motorists. The PDRMO chief assured the public that all evacuation sites are ready.
The challenge kasi dito is yung COVID, especially sa evacuation centers. How are we going to implement, should we say, social distancing. Realistically, mahirap talaga. No? So, the best thing we can do, sabi ko nga ako sa is just observe the minimum health standards na lang. Mag-face mask na lang, tapos regular hand washing. Tapos yung mga yung mga senior citizens natin, yun ang ihiwalay ng konti.
Risa, although Tropical Storm Arwing is expected to weaken further as it nears landfall, Cebu officials are urging the public to remain on high alert status as it could still bring moderate to heavy rain once it traverses here in Visayas region. Risa.
Thank you, Jenny. That was Jenny Dongan reporting live from Cebu City. Meanwhile, Malacañang assures the public that there are enough relief stockpile and funds for those who may be affected by Tropical Storm Auring. Presidential spokesperson Harry Roque said the Social Welfare Department has stored up supplies and standby funds amounting to 1.2 billion pesos. Roque added that the Health Department has prepared more than 19 million pesos worth of medicines, medical supplies, and health kits. Now, over in the United States, a United Airlines flight landed safely at the Denver International Airport after its right engine failed. The Boeing 777-200 plane was heading to Honolulu when it suffered an engine failure soon after takeoff. The aircraft was carrying 10 crew members and over 200 passengers. Dramatic images from the Broomfield, Colorado police showed significant plane debris on the ground. Now, another video showed that the engine was on fire. No injuries have been reported from the incident. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.